The coronavirus curve is frighteningly climbing in Kenya. And this is not only unsettling the government, but healthcare workers too, who feel underprotected, overwhelmed, and vulnerable to the infection. With the virus changing how we all live and engage, and a fractured healthcare system, can Kenya look inward for its supply lines and reduce dependency on foreign countries for medication and restructure the country's healthcare system? I'm Ayub Abdikadir Abdi. This is the Primetime News on Ebru television. Our sign anchor tonight is Joyce Wairimu. Coming up in the next 30 minutes. Welcome to the broadcast. The short SMS code is 40920. The hashtag on Twitter is News Compass. Later we'll be talking to Nairobi County Health CAC, Hitan Majevdia, who is on set at the moment, as you can see on your screens, and will be taking stock of the preparedness level at the county of Nairobi and equally the general response by the national government in regard to the coronavirus pandemic. Standing by live on Skype from California in the United States of America is a Kenyan graduate journalism student, Ashley Njoroge, who will be taking us through some of the aspects in regard to the coronavirus pandemic in the United States of America and the lessons so far, despite, of course, criticism which are deep in regard to the Donald Trump misjudging of the situation from the onset in the United States of America. At home, though, another person from the county of Mombasa has succumbed to the coronavirus, bringing the death toll in Kenya to 7, with infected cases rising to 184 after 5 new cases were confirmed by Health Cabinet Secretary Mutahi Kagwe this afternoon. Kagwe will address in daily updates cautioned small business operators in the country, including Juakali artisans, against ignoring the coronavirus precautionary measures set out by the ministry, and that includes wearing of masks. Our reporter Jeff Khaimba attended the daily briefing of the minister, and here is that story.
That coronavirus pandemic is a deadly monster is indeed no doubt. This comes even as the number of the people who have succumbed to the disease continues to surge, as pronounced by the Health Cabinet Secretary Mutahi Kagwe.
But I'm also sorry to say that we also lost one person in Mombasa in the last 24 hours. The person had passed on before. They had not noticed that the person died too quickly after going to hospital, had other cases as well, but died, and upon death during the postmortem is when they realized the person was also positive.
Besides the country recording a new death, the number of the infected persons increased gradually, even as the recovery cases also jumped up, an indication of hope in the health sector.
3 are Kenyans, while 2 are foreign nationals. And 3 of them had traveled, 1 each from Tanzania, and 1 from the UK and 1 from the United Arab Emirates. An additional 4 persons have been discharged in the last 24 hours, having moved from positive to negative status.
The Health Cabinet Secretary Mutahi Kagwe said contact tracing was ongoing, noting that a total of about 2,046 persons had been monitored, out of which 1,448 had been discharged, with 598 on follow-up. By now, the government has begun shutting down some quarantine centers, particularly those in hotels.
I'm also pleased to say that we have managed to close down a number of quarantine facilities, which include the Trademark and Hill Park hotels. In this regard, we are kindly appealing to fellow Kenyans to warmly receive those of us that are in those facilities and have since been released to go home. There should be no stigmatization. Ukiendelea na kazi na mtu anakuja humjui na anashika mboga, mnazungumza na yeye hana mask, mwingine atakuja na mwingine atakuja. Kijiji nzima inapitia hapo, na wewe mwenyewe huvai mask, na ukai bali na mtu yule mnazungumza na yeye. Hiyo ni kumaanisha ya kwamba ikiendelea namna hiyo, wewe utapata hii virusi. Wao unamtengeneza nywele yake akiwa amekaa hapo na wewe uko hapa, anasoma gazeti, wewe unaendelea na kazi yako, asipokuwa na mask, wewe huwezi kujua kama ni virusi. Sasa unachika dakika hiyo.
Kagwe, on the other hand, warned the border operators, small-scale traders, and the Juakali artisans against flouting the COVID-19 measures. Until now, more than 88,000 persons has died of COVID-19, with about 1.5 million people being infected. Reporting for Ebru TV, I'm Jeff Khaemba.
The Aga Khan University Hospital has confirmed that its members who are in isolation after coming into contact with a patient infected by COVID-19 are doing well. This is after a 66-year-old man died of the virus at the institution. The hospital has also set up 100 beds to cater for COVID-19 patients in the country, as our reporter Abdikadir Hashim now tells us in the following story.
Since the first patient succumbed to the novel coronavirus in the country, the government has been taking measures to intensify the fight against COVID-19 as cases in the country continue to soar. The first patient succumbed at the Aga Khan Hospital, where the deceased came into contact with the staff at the hospital that led to their isolation at the facility.
They're all doing fine. Basically, we have a very, very rigorous process. If somebody comes in contact with a patient that is suspect and we believe they might have been, for example, exposed, what we will do, we trace them, we put them in a 14 days isolation, we test them. When we believe that they are healthy, they can come back to.
The hospital showcased how they will handle patients infected with the virus. Once the patients are brought to the hospital, they'll be taken to the accident and emergency observation room, where the doctors will be administering a COVID-19 test. Those patients in critical condition will be taken to the intensive care unit ICU, and others will be taken to the isolation ward. The hospital has set up 100 beds to cater for COVID-19 patients.
In ICU, we have already made a provisions to expand our ICUs. We will be basically able to look at after basically 20 patients in our ICU, but we have also an HDU, which we have reserved for other patients because we haven't shut down our hospital.
This comes even as the government, through the Ministry of Health, warned private hospitals to not overcharge patients seeking treatment of COVID-19.
Fellow Kenyans, it has also come to our attention that there are private hospitals who are overcharging Kenyans and taking opportunity of this pandemic. We have reports of gloves and other PPE equipment that are costing about 8,000 Kenya shillings for Kenyans who are admitted in facilities. This is unacceptable and immoral, and the Medical Council has been directed to take up this issue.
Doctors at the hospital have urged Kenyans to adhere to the Ministry of Health protocols to combat the spread of COVID-19. More than 1 million people around the globe have been infected with the novel coronavirus, and 60 of them have succumbed to the said virus. Private hospitals here in the country are taking measures to ensure they combat this deadly virus. Abdikadir Hashim, Ebru TV, Nairobi County.
The government should impose a lockdown as soon as now before it's too late. This is according to health workers who say imposing a lockdown when the number of infected cases in the country is still small will help curb the spread of the virus in the country, thereby reducing cases of fatalities from the highly contagious COVID-19. Winnie Lubembe expounds.
That there shall be cessation of all movement by road, rail, or air in and out of A, the Nairobi metropolitan area, and B, the counties of Kilifi, Kwale, and Mombasa.
This announcement by the president to halt movements in high-risk counties is intended to reduce the spread of the virus. However, this is not enough, as closing down the borders of these counties and not testing people will not bear much fruit, as the country is currently not doing mass testing. Speaking with Ebru TV in a one-on-one interview, the Kenya National Union of Clinical Officers Chair Peterson Washira says delaying the lockdown will have worse outcomes.
If you wait, you infect more people. It will be over a wider region, maybe even countrywide. You'll have to lock down for longer. There will be devastating economic effects. And of course, there will be loss of lives for many people that would have been avoided. Okay. So actually for us, we have been asking for a total lockdown in the high-risk counties. Once we do that, because a lockdown is not just halting. When you halt, you must have some objectives.
He notes that during the lockdown, mass testing should be done on a door-to-door basis for all Kenyans.
This disease has shown that it has an average incubation period of 5.2. So by 7 days, whoever was infected will show symptoms. If they have to, because about 80% of them, they do not show any symptoms. And so you can be able to get those who have been infected. And then after that, you can quarantine them and open very fast, and the economy will recover.
The lockdown question has been on so many Kenyans' lips, to which the health CS, Mutahi Kagwe, said the government is holding discussion on the same. The CS, however, want Kenyans to prepare for tough times ahead as the number of infections keep rising.
That, my friends, fellow Kenyans, let us brace ourselves for bad news. Let us be ready, because all the measures that we are going to take will not stop the disease abruptly. It is already here with us.
Among the countries that imposed total lockdown, China has seen a success as they were able to contain the spread of the virus and is no longer considered an epicenter. Other countries that have imposed a lockdown include Uganda, South Africa, Ethiopia, Rwanda, Italy, among others. Winnie Lubembe for Ebru TV.
Since the coronavirus outbreak across the world, several studies have been done on how long the virus can survive on different surfaces or how long the virus can live in the air. Diana Rachel Mbuga now takes us through some of the studies, including what the World Health Organization indicates in its update.
Well, thank you, Ayub. Now, tonight we want to just try and demystify some of the questions that a lot of people have been asking about how long the coronavirus can last in some surfaces or how long it can live in the air. And of course, there are some different studies that have been done by different people, including the World Health Organization, of which is the organization, of course, that we would just like to see first what they say. Now, how long does the virus survive on surfaces? WHO says it is not certain how long the virus that causes COVID-19 survives on surfaces, but it seems to behave like other coronaviruses. Now, studies suggest that coronaviruses, including preliminary information on the COVID-19 virus, may persist on surfaces for a few hours or up to several days. Now, this may vary under different conditions. For example, the type of surface, type of temperature or humidity of the environment. Now, we just want to take a look at some of the studies that have been done on different surfaces. And of course, we'll start with what this study says about the metal, for examples, the doorknobs, jewelry, the silverware that you're wearing perhaps every day. The virus could live on the surface for 5 days. On wood, that is furniture, decking, these are the things that you handle every day, you have in your house, that is the tables. It could last for up to 4 days. And then there is plastics. Of course, this is also something that you come across, you interact with every day, packaging like milk containers, detergent bottles, subway and bus seats, backpacks if you have elevator buttons. The virus could last to 2 to 3 days, according to this study. Well, some studies also say that for plastics, it could last for up to 7 days. For stainless steel, they have examples of refrigerators, pots and pans, sinks, some water bottles. This is some of the things you're using every day in your kitchen. It could last to 2 to 3 days. You have cardboard. These are, of course, examples like shipping boxes. This could last, the coronavirus could last for up to 24 hours. We have copper also. This is the pennies or the coins that you have in your pockets, tea kettles, cookware. That's why we're encouraged to even just use cashless transactions. This could last for 4 hours, the COVID-19. Also, aluminium, that is soda cans, tin foils, water bottles, if you have aluminium foil. The virus could last up to 2 to 8 hours, could live in the aluminium for 2 to 8 hours. If you have glass, drinking glasses, measuring cups, mirrors, windows, this could last up to 5 days. Of course, this is something as well that you are using every day, for example, in your kitchen to drink water and so on. We have ceramics, that is dishes, pottery, mugs. This could last 4 or 5 days. Now, if you're in the office and you're using paper, the length of time varies. Some strains of coronavirus live for only a few minutes on paper, while others live for up to 5 days. This is something else that is very sensitive because you have to eat. Coronavirus doesn't seem to spread through exposure to food. Still, it's a good idea to wash your fruits and vegetables under running water before you eat them. Scrub them with a brush or your hands to remove any germs that might be on their surface. So this is just the normal thing you have to do, that you usually do every day. Wash your hands after you visit the supermarket. If you have a weakened immune system, you might want to buy frozen or canned produce. When it comes to water, coronavirus hasn't been found in drinking water. If it does get into the water supply, your local water treatment plant filters and disinfects the water, which should kill any germs. But of course, just make sure you boil your water here if you don't have a filter in the house. So coronavirus can live on a variety of other surfaces like fabrics and countertops. Now, other studies have argued that coronavirus could live in the air for several days, for at least 3 hours from other studies. Now, we want to take a look at what the WHO says that you should do just in case, of course, someone who is infected has come into contact with the surfaces that you're using. So if you think a surface may be infected, clean it with simple disinfectant to kill the virus and protect yourself and others. Also, clean your hands with an alcohol-based hand rub sanitizer or wash them with soap and running water. Avoid touching your eyes, mouth or nose. So the key thing really is to always wash your hands. Make sure you wash your hands so that you don't interact with your face, your hands, your eyes, your nose or your mouth. So this study also says to reduce your chance of catching or spreading coronavirus, clean and disinfect all surfaces and objects in your home and office every day. So for example, when you get into the office, make sure you sanitize your desk, your mouse, the keyboard that you're using, just to make sure that it is well sanitized. Countertops, the doorknobs that you're using, bathroom fixtures, your phones especially. This is something we're using every single minute of our lives. Keyboards, remote controls, and also the toilets. Okay, use a household cleaning spray or wipe. If the surfaces are dirty, clean them first with soap and water and then disinfect them. So of course, this is something that we have been encouraged to continue doing as we continue to curb the spread of COVID-19. Back to you, Ayub.
Thank you, Diana. Now, the Deputy President, William Ruto, has emphasized that the government has set out isolation and quarantine centers across the country as the government takes proper measures to curb the coronavirus pandemic. Speaking for the first time over the novel coronavirus crisis in the country, Ruto confirmed that the government has already selected a number of boarding schools across the country, including counties, to be used as isolation centers should the pandemic get out of control.
The fight against coronavirus is a paradox. While on the one hand, we have a deadly virus that threatens to wipe out people and disrupt the world on a scale never before experienced, defeating it completely, on the other hand, takes such basic measures and elementary precautions. We must not be confused by the simplicity of washing hands, social distancing, and staying at home to underestimate the deadly, dangerous, and destructive coronavirus. Let us remember that the coronavirus cannot move or multiply by itself. It desperately needs our bodies for mobility, for transport from one victim to another, and from one locality to another. Curtailing our movements will completely immobilize this enemy and stop its spread. This is why we urge those who can work from home to do so, while those who must work in factories, offices, business premises, and such other areas to meticulously exercise social distancing. Employers should adopt a shift system that enables staff to work at different times of the day or on different days to minimize congestion in workplaces.
All right, we, of course, been listening to the Deputy President, William Ruto, who earlier on addressed members of the press at his current residence here in Nairobi County. For now, though, from Nairobi, we head to California in the United States of America and join or link up with Ashley Njorega, who is a Kenyan journalism graduate student in the United States of America, the epicenter of the coronavirus crisis now, and the attention of course, the World Health Organization is on the Donald Trump-led country in that part of the world. Good afternoon on your end, Ashley. I'm much interested about the concerns many Americans have in regard to the muddled messaging from the White House in regard to Donald Trump's refusal and systematic denial of scientific advice in regard to the coronavirus pandemic. How worried are you alongside Americans?
Hi, thank you so much for having me. So I think that different people are reacting very differently to this story, especially depending on what state you're in. So states like New York have a hard time, and it's so painful seeing Trump. When this thing started, he said that Corona is going to disappear like a miracle, and now, of course, they're saying that they're going to open up the economy in May, and we're just not sure what's going to happen. So I guess what's really troubling is the fact that we keep getting such different advice from different people, and you're not even sure who you want to listen to at this point, so it can get very, very confusing.
Well noted, Ashley, and thank you for that update. In regard to the supply chain, has there been a situation where you, like many other Americans or foreigners who live in the United States of America, have been impacted by the lack of basic necessities, say, for instance, in supermarkets and shops?
Definitely, there's no tissue anywhere, and this tissue story set it off as a joke, but there is literally not been tissue in stores for the last, I would say, for the last 3 weeks. However, when it comes to groceries, the grocery stores are very well stocked. You just have to make a really long queue. You have to wait for like 30 minutes to be able to get inside a grocery store. But in terms of tissue paper, that's where we're really struggling. And of course, we don't have face masks. And we've seen California, for example, donate 500,000 face masks to the New York state just to make sure that they are okay. So it really depends on where you are.
All right. And of course, worth acknowledging that you live in a free society and of course, the free world, that is the United States of America. And of course, there are lockdowns, and that has impacted movements of people from one state, say, to another. And with the generalization of banning all flights from the European continent, in some aspect, have you felt that some liberty freedoms, as per, of course, as enshrined in the U.S. Constitution, have been affected in terms of confining people because of the restrictions imposed by the federal government?
Definitely, the restrictions have been the biggest change in life here. We've seen over 17 million Americans file for unemployment. This is the worst number since the Great Depression. So businesses have been closed, people are home, we're not doing anything. I've personally been home for a month, and the only time I leave is to go for a run. The only difference between here and Kenya is that nobody punishes you for not being home by 7. But the thing is, people here really listen to the instructions. So when we were told to shelter in place, which basically is what the lockdown is, people are just not going outside. So it has really, really, really changed how we live. And every other time you're on a Zoom call or like a meeting online, and we just have almost no face-to-face interaction here anymore. That's, I think, the difference between where Kenya is now and where we are. And I think we were where Kenya is a month ago. So we're really, really hoping that people at home take this seriously so that they don't have to get to a place like this, because unemployment is the biggest first factor, bad health and death.
All right, then what are the lessons that perhaps Kenya can learn from the U.S. experience in regard to now becoming the epicenter? And from the onset, it was a case of Donald Trump misjudging the situation, as was the case with the A Diamond Princess ship which was set to dock in the port city of Yokohama in Japan by Shinzo Abe's government, that Kenyans need to be self-disciplined if we are to keep this pandemic at bay and not hit the standards. Currently, of course, the United States enjoys across the world with more than 400,000 cases.
So the first lesson, in my opinion, is misinformation. So our misinformation started from the very top, from the president himself. But I guess another form of misinformation that we've seen is a lot of the news going around on our WhatsApp groups it's not true. People are spreading so many rumors. In Kenya, I've seen so many videos of people who think this is a conspiracy theory, people who think that this is a disease for the rich. And, there's just so much misunderstanding on what corona is. And I think in the US, when this started, we had a belief that people said that Black people are not going. But now what's happening is that the Black people are the ones who are getting it most and the ones who are dying from it most. So I think what Kenya should learn now is there needs to be good education on behalf of on the citizens so that they understand what's really going on. Because as long as citizens don't understand what's at stake, they're not going to comply. And as long as they don't comply, we're in a lot of trouble. So I think we need to sensitize the public. I don't think that's happening well.
Okay, and in regard to, of course, the nationalistic election year lying ahead for the United States of America, of course, heading to the ballot in November 2020, and accusations that have been very rife since Trump assumed the office in January 2017. Is there a spike in the cases of hate crimes in the United States of America, say racial, xenophobic, and anti-Semitic in regard to the coronavirus pandemic since the first case was confirmed in the United States of America?
Yeah, definitely a lot of Asian people from the Asian community did experience that, and a lot of it also happened for Asian-owned businesses where people stopped going to their businesses completely. And Mike, the Secretary of State, Mike Pompeo, and Trump, they've been saying that this is a Chinese virus at every opportunity that they can get. So they have continued to stigmatize the Asian community that we have here. And that's been one of the biggest problems we have. So that's definitely been one of the effects.
All right, talk to me about then the sort of fragmented effort between the federal government and the states across the United States of America. For instance, the New York governor has been critical of the government, saying we need 30,000 ICU ventilators. Donald Trump's administration delivered only 400 for a city that never sleeps like New York City in the United States of America that harbors the world financial market. What does it say about the needed joint effort, which was to enmesh both efforts at the federal and county level in the U.S. that in terms of responding to the pandemic? And what lessons can we, Kenya, learn from the U.S. experience?
One of the problems that we've faced here is how much this whole pandemic has been politicized. There's so much propaganda and there's so much politicization. We've seen Trump basically kind of imply that how they're going to respond to states is based on the relationship that he has with the governors of those states, which obviously is really shocking because this is people's lives at stake. So I guess one of the things I would say when they're not getting enough PPE, first of all, it's because we were not prepared, even though we knew that this was coming. And I guess in the same breath, Kenya should make sure that they're prepared because they know that this is coming. But the other thing people should stop doing is stop politicizing the pandemic because this has people's lives at stake.
Okay, talking about the personnel, protective equipment needed by healthcare workers, say in the United States of America, of course, it's equally a very important subject here back at home in Kenya. But equally, what does it say about the point with which 1 in 10 Americans with no medical insurance, the pandemic hitting home, the U.S. now ranks first. Donald Trump said it was the Chinese virus in the White House press briefing room before the start of the virus, before them at the infancy stage of the virus, and even tweeted what he said, very much under control. And today, it is a totally different picture in the United States of America. Is the government, federal government, responding enough to the clarion calls raised by the health workers in the United States of America?
I will give a caveat because I'm not a health worker myself. However, I think what's happening is that I know that the US is doing everything that they can. We've seen that they're paying 4 times more to be able to get PPE, and they're even kind of taking PPE from other countries just to make sure that we have as much supplies as we can in the US. We've seen other states being able to donate their PPE to New York, for example, because that's where it's been been hit the most. So I would say that there's a sense of community and people are doing everything they can. But I guess the other thing is there's very little counties in some of the states which have like no PPE at all. So this morning I was on a call with a very small county here in California, and they basically told me that they have 9 ICU beds, and they just have no idea what they're going to do when if anything goes, if the cases continue to soar. But what we've also seen is like joint efforts. Hotels have been converted into hospitals. We've seen a lot of makeshift hospitals. We've just seen a lot of hands come on deck. We've seen people volunteer. We've seen people give a lot of donations. So there's a sense of community, which I think is really helping with the situation.
Okay, before I let you go, one final question. I'm sure you must have been keeping track of the government's response back at home here in Kenya, and in regard to, of course, so far laid out procedures by the government and measures so far in the fight against the pandemic. From your judgment, is our response enough?
I mean, it breaks my heart to say this, and it breaks my heart to say this on national television. I think it's not enough. I think that, I've seen what the government is doing in terms of the first thing that comes to mind is the money that they are allocating to the people in the entertainment space. And for me, that just felt like a PR exercise, because those are the people who interface with citizens at a large extent. And if they're happy, they're going to go preaching a good message to the citizens. So I personally thought that was a very PR kind of exercise. In terms of like reduction in taxes, what I would say is I'm happy that the government is getting people to stay on lockdown. I think that there needs to be more education so that members of the public can take this more seriously, because it's not an issue of this is just a flu. The problem is if this flu gets so many people at the same time, the healthcare system will collapse. So I think more effort should be put into making the Kenyans understand what's at stake. And that way, when we have buy-in from people of the community, we'll be able to move forward in a better way. But I think the government can do a lot more. There's so much that's not been addressed. And I think what they started with is probably the least important of the things they should be addressing.
All right, Ashley Njoroge, thank you so much. A Kenyan graduate, a journalism graduate student joining us live from California in the United States of America. And good afternoon. Thank you for your assessment of the situation in the US and equally here in Kenya. Now, the Central Bank of Kenya, CBK, has suspended Absa Bank Kenya's foreign exchange license for 7 days for failing to report specific foreign exchange trades it conducted last month in March. Kaindo Stefano with more.
In a statement on Thursday, CBK Governor Patrick Njoroge said Absa flouted the anti-money laundering rules during the trade, hence the actions. In a statement, Njoroge said, and I quote, "During this period, Absa cannot transact in the interbank foreign exchange market. However, all committed transactions as at April 8, 2020 can be settled." End of quote. Njoroge said Absa did not have satisfactory assurance of the underlying commercial transactions supporting these trades as is required. The bank has been ordered to reverse the market position that were created as a result of the alleged transactions. Absa should also by Wednesday, April 15th, put in place a robust framework that ensures all relevant documents for such foreign exchange transactions are available as required, and also to ensure the other requirements are adhered to. This move comes barely 3 months since transforming from Barclays. The lender is expected to complete the rebranding and transition process before June 2020. Absa has been undergoing a transition after parting ways with Barclays PLC, which reduced its shareholding in the African Financial Services Group to a minority stake in 2017. Barclays Africa operates in 12 countries with approximately 40,000 employees who serve close to 12 million customers. Reporting for Ebru TV, I'm Kaindo Stefano.
The national women's basketball team star forward Felmas Koranga is in line to become the first female player from Kenya to play in the National Collegiate Athletics Association Division I League after signing for Troy University in the United States of America. Koranga was named in the 2020 Women Basketball College Association WBCA. Player of the Year at the just concluded season, while at Taylor College in National Junior Collegiate Athletics Association League. Koranga's last assignment for Kenya Lionesses was the Africa Zone 5 Championship in Uganda last June in 2019, where Kenya finished second behind Egypt. During her 2 years at Tyler, she amassed 1,000 points and 750 rebounds, a college record. The Kenya Golf Union has called on clubs all over the country to set up welfare kitties for caddies who have essentially been thrown out of work after the latest government directive to curb the spread of the novel coronavirus in the country. Health Cabinet Secretary Mutahi Kagwe directed that all golf clubs in the country, be closed after violating the social distancing rules, continuing the activities as normal despite the threat posed by the pandemic. In a statement signed by Chairperson Anthony Murage, the union says that caddies whose services will no longer be used under the directives will be hard hit financially, hence the need to have them supported. Meanwhile, Murage says they will only comply with the directive to shut down all club houses, but individual caddy-free golfers will be allowed to club, but on member-only basis. Meanwhile, the union has suspended all handicaps in the country for a period of 30 days as the country continues to monitor the spread of the coronavirus. The curtains fall on the primetime news. Coming up next after the break, a conversation that regards, of course, the response so far by the county government of Nairobi in regard to the coronavirus crisis, the 1.2 billion kitty offered by the City Hall in the country under a new form of administration and a new look, and how that should be intertwined and enmeshed with the efforts so far laid out by the government, the national government, in this regard against the pandemic in the country, with the number now hitting 180 plus and projected results by the Minister of Health indicating Kenya could record as high as 10,000 cases by the end of this month. We'll be discussing that with the Nairobi County Health CEC Hitan Majevdia, who is on set in studio. And that discussion is coming up next after the break here on the broadcast on News Compass. The hashtag to use is News Compass, and later we'll sample some of your feedback. Stay tuned.